to discuss about rule of W. As a surgeon, everyone will be aware of what rule of W is about. So first we'll see where this rule of W is given. So this is given in Bayesian Law 20th edition on page number 318. Rule of W is simply a mnemonic for teaching on postoperative complication. This tells about the timing and incidences of postoperative complication. We'll get back to this chart once the complications are discussed. So on day 0, the W is wave. So on day 0 we have to rule out myocardial infarction and fluid overload. Day 1 the W is wind, so rule out atelectasis. If this is not ruled out on day 1, on day 2 and day 3 it can lead to pneumonia. Day 3 W is water, rule out urinary tract infection. Some points to be noted in this: the most common cause of hospital acquired infection is UTI. But if they asked what is the most common cause in surgical patient, then it will be surgical site infection. And most common cause for fever is atelectasis. Day 5 is for walking. So on day 5 we need to rule out DVT. Also surgical site infection can also occur from day 5. There is no fixed timing. It can occur in between day 5 to day 7 also. Day 6 the W is wound, so rule out surgical site infection. What do you mean by surgical site infection? So it is an infection. It is a wound infection which occurring within 30 days of surgery, or if there is an implant within 1 year of surgery. Even burst abdomen which also occurs on post-op day 6, where the patient mostly present with Salmon fluid sign or serous fluid sign, where large quantities of serous fluid comes out. Lastly, day X. Why day X is for wonder. Why day X? Because there is no specific day on which this complication can occur, which can mostly include adverse reaction because of some antibiotics or any drugs, and thrombophlebitis, which can occur on any day at the site of IV cannula. So we need to rule out all this W on post-op patient, mostly wave, wind, water, walking, wound and wonder. So we'll discuss about this chart. Here post-operative days are given and incidence estimate in 10,000 population is given. So when we look at this chart, we come to know that most of the complications occur within first 7 to 8 days, and the most common post-operative complication is here. The incidence is 25 in 10,000 population, that is surgical site infection. Second most complication is the green one, that is pneumonia, and the third is urinary tract infection, that is 15 in 10,000 population. The least complication is of the myocardial infarction and venous thromboembolism. Thank you for listening. If you like this video, please like, share, comment and subscribe to the channel. Thank you.